$880 billion that it has been told to cut without cuts to Medicaid. The Congressional Budget Office has confirmed that. And we've seen Republican proposals floated that would impose per capita caps, eliminate the 90% federal matching rate for Medicaid expansion, and implement burdensome work reporting requirements. And I want to focus a bit on what happens if we eliminate the 90% federal matching rate and how it relates to addressing mental health and substance use disorders. Medicaid is the largest payer for behavioral health services, including treatment for substance use disorders, and covers nearly 40% of Americans living with an opioid use disorder. Now, in Virginia, there were over 133,000 Medicaid beneficiaries with an identified substance use disorder. Virginia is one of 9 states that have trigger laws that state all of the individuals covered under expansion would immediately lose access to their health care and therefore substance use treatment if cuts to Medicaid include cuts to that 90% match. In rural areas, community health centers play a critical role in treating substance use disorders, and cuts to Medicaid could close rural hospitals. When we expanded Medicaid in Virginia, a big reason why Republicans in rural areas supported it was because it would keep their hospitals open. And we have seen estimates that every hospital west of Charlottesville, Virginia could close if we unwind Medicaid expansion. Our community health centers serve patients at over 200 service sites in Virginia, 44% in rural areas that would be at risk if Medicaid is unwound. And so I think it's important to look at this bill in the larger context of what is happening in this Congress, what is happening with this administration. And the goal here, I think we all agree, is we want more Americans to be healthy. And Medicaid patients actually are healthier than private pay patients in many cases because they are connected to medical homes for the first time sometimes in their life. And when they show up for medical visits, they're often less expensive than private pay providers. So let's look at the big picture and look at what, as we pass a bill to address the opioid and substance use disorder, let's look at what would happen and how useless this bill will be if there are Medicaid cuts that come out of this committee as early as next week that unwinds the very services being used to provide opioid or substance use disorder treatment to 40% of Americans. Thank you, and I yield back.
The gentlelady yields. Is there any further discussion? Seeing no further discussion, a roll call vote has been requested. The clerk will call the roll.
Mr. Latta. Mr. Latta votes no. Mr. Griffith. Mr. Griffith votes no. Mr. Bilirakis. Mr. Bilirakis votes no. Mr. Hudson. Mr. Carter of Georgia. Mr. Carter of Georgia votes no. Mr. Palmer. Mr. Dunn. Mr. Dunn votes no. Mr. Crenshaw. Mr. Crenshaw. Mr. Crenshaw votes no. Mr. Joyce. Mr. Joyce votes no. Mr. Weber. Mr. Allen. Mr. Allen votes no. Mr. Balderson. Mr. Balderson votes no. Mr. Fulcher. Mr. Fulcher votes no. Mr. Pfluger. Mrs. Harshbarger. Mrs. Harshbarger votes no. Mrs. Miller-Meeks. Mrs. Kamick. Mrs. Kamick votes no. Mr. Obernolte. Mr. James. Mr. James votes no. Mr. Bentz. Mr. Bentz votes no. Mrs. Houchin. Mr. Fry. Mr. Fry votes no. Mrs. Houchin. Ms. Houchin votes no. Ms. Lee. Ms. Lee votes no. Mr. Langworthy. Mr. Langworthy votes no. Mr. Kane. Mr. Kane votes no. Mr. Rulli. Mr. Evans. Mr. Goldman. Mr. Goldman votes no. Mrs. Fedorchak. Mrs. Fedorchak votes no. Mr. Pallone. Mr. Pallone votes aye. Ms. DeGette. Ms. DeGette votes aye. Ms. Schakowsky. Aye. Ms. Schakowsky votes aye. Ms. Matsui. Aye. Ms. Matsui votes aye. Ms. Castor. Aye. Ms. Castor votes aye. Mr. Tonko.
Aye.
Mr. Tonko votes aye. Ms. Clark. Ms. Clark votes aye. Mr. Ruiz. Mr. Ruiz votes aye. Mr. Peters. Mr. Peters votes aye. Mrs. Dingle. Mrs. Dingle votes aye. Mr. Veazey. Mr. Veazey votes aye. Ms. Kelly. Ms. Kelly votes aye. Ms. Barragan. Ms. Barragan votes aye. Mr. Soto. Mr. Soto votes aye. Ms. Schreier. Ms. Schreier votes aye. Ms. Trahan. Ms. Trahan votes aye. Ms. Fletcher. Ms. Fletcher votes aye. Ms. Ocasio-Cortez. Ms. Ocasio-Cortez votes aye. Mr. Auchincloss. Mr. Auchincloss votes aye. Mr. Carter of Louisiana. Mr. Carter of Louisiana votes aye. Mr. Menendez. Mr. Menendez votes aye. Mr. Mullen. Mr. Mullen votes aye. Mr. Landsman. Mr. Landsman votes aye. Ms. McClellan. Ms. McClellan votes aye. Chairman Guthrie.
No. How is Mr. Weber?
Chairman Guthrie votes no.
Weber?
Mr. Weber is not recorded.
You're
Mr. Weber votes no.
Hudson? Mr. Hudson?
Mr. Hudson votes no.
Dr. Miller Meeks?
Dr. Miller Meeks is not recorded. Dr. Miller Meeks votes no.
Obernolte?
Mr. Obernolte votes no.
You guys all voted already. So anybody else seeking recognition for the roll call? Seeing none, the clerk will report.
Chairman Guthrie, on that vote, there were 24 ayes and 26 noes.
The amendment is not agreed to. Is there further amendment? Are there further amendments? The gentlelady from Massachusetts, Ms. Trahan, what purpose do you seek recognition?
Mr. Chairman, I have an amendment at the desk titled Trahan_011.
The clerk will report the amendment.
Mr. Chairman, I would reserve a point of order.
There's a point of order reserved by the gentleman from Virginia. The clerk will report the amendment.
Amendment to the amendment in the nature of a substitute to H.R. 24.
Without objection, the reading of the amendment is dispensed with, and the gentlelady from Massachusetts is recognized for 5 minutes for support of the amendment.
Thank you, Mr. Chairman. My amendment narrowly focuses on the health and well-being of millions of Americans who depend on Medicaid for life-saving substance use disorder and mental health services. Now, as has been said, my Republican colleagues are pushing to cut $880 billion from programs under our committee's jurisdiction. We know that those details will not be shared with us or the American people until hours before we're back in this room next week. Individuals battling addiction, and we know Medicaid serves as a lifeline for individuals battling addiction and mental health conditions. It provides coverage for a significant portion of those seeking treatment ensuring the services are accessible regardless of income. The proposed cuts threaten to dismantle these vital services, potentially leaving countless individuals without the support that they need to recover and lead fulfilling lives. And I know what my colleagues are going to say, because this markup is, it's just been an exercise in avoiding the $880 billion elephant in the room. But you can appreciate the position that we're in, passing a bill that is largely bipartisan, only to have the rug pulled out from under the people we represent next week. This amendment ensures that any funding reductions do not compromise the coverage of substance use disorder and mental health treatments or restrict the eligibility of individuals requiring these essential services. Now, my Republican colleagues want Americans to believe that cutting Medicaid is about rooting out waste, but in reality, it means eliminating coverage for people who are just trying to recover. Protecting these services isn't just about coverage, it's about making sure that people can actually get the care that helps them get back on their feet. It's about real lives, real families, and making sure that we don't abandon people when they're at their most vulnerable. And I just want to be clear about this. If House Republicans move forward with these level of cuts, they are threatening the very foundation of our country's response to the opioid and mental health crises. Medicaid is what makes treatment possible for millions of people. Gutting it will mean fewer treatment beds, longer wait times, more people slipping through the cracks, and more preventable deaths. It means more empty seats at the dinner table, lives lost not because we couldn't help, but because Republicans in Congress chose not to. Every member of this committee should vote to protect the core programs that we oversee. I urge my colleagues to support this amendment because it is proactive. We don't want to lose ground in the fight against addiction, and so we have to keep Medicaid strong for the people who need it most. Thank you. I yield back.
Thank you. The gentlelady yields back. The chair recognizes the gentleman from Georgia, Mr. Carter, for 5 minutes.
Mr. Chairman, while I appreciate my colleagues' interest in supporting individuals with substance use disorder and mental health conditions, this amendment, once again, is unnecessary. The SUPPORT Act we are considering today proposes no changes whatsoever to Medicaid. As evidenced by the bill under consideration today, Republicans have made clear that this committee will continue to focus on substance use disorder. This work will build on the inroads Congress made last year, which includes reforms to lift the IMD exclusion for substance use disorder treatment to Medicaid and to expand access to Medicaid's coverage of addiction treatments, including policies to suspend coverage for beneficiaries while they're in incarceration so that the coverage can resume immediately upon their reentry into the community. We've made it clear that we want the Medicaid program to focus on the most vulnerable populations among us, including those with substance use disorders. Again, I will note that today's bill does not make any changes whatsoever to Medicaid, and this amendment, again, is unnecessary. I yield back.
Will the gentleman yield?
I yield.
This is kind of played out all day, where we say it's unnecessary because of the bill before us that we all, many of us support. I don't see the problem with voting for an amendment that would safeguard the very bill that we are passing from future threats that could be coming. Maybe they won't. Maybe you're right and you're not going to touch Medicaid for people who are struggling with substance use disorder and mental health. But why wouldn't you give the insurance to the American people by voting on that amendment and safeguarding that coverage for folks?
Mr. Chairman, reclaiming my time, if we tried, Mr. Chairman, to guard against everything that might happen, we'd be here forever. We've made commitments that this is not going to happen. So I just find it unnecessary to have this amendment once again, as I found the others unnecessary as well, and I yield back.
Thank you. The gentleman yields back. Further discussion? Gentleman from New York, what purpose do you seek recognition?
Mr. Chair, I move to strike the last word.
Gentleman is recognized.
Well, listening to the comments, House Republicans are seeking massive, devastating cuts targeted squarely at our most vulnerable communities. and putting vast numbers of children, seniors, and people with disabilities at risk of losing their Medicaid coverage. These reckless cuts are so much more than just numbers on a page. They threaten the lives, they threaten the livelihoods of real people across America. In my district of New York 20, Medicaid insures more than 192,000 individuals. Millions of Americans would suffer if Trump and Musk achieved their goal of slashing these programs. Medicaid is also the single largest payer for behavioral health services, so that any cuts would mean gutting access to health care for mental health and substance use disorders. Is that really what we want to cut? Repealing Medicaid expansion would rip coverage away from millions of insured individuals that are struggling with addiction and behavioral health needs as we speak. Additionally, Medicaid coverage can play an integral role in preventing a mental health crisis and in preventing substance use disorder. So if Medicaid cuts were put in place, states would be forced to take on more of the burden and shift further resources away from other services, including prevention, including treatment, and including recovery. So we must stop Medicaid from being decimated so that our loved ones living with the disease of addiction or living with a mental health disorder can access needed care. This is about doing preventative therapy here. It's making certain we make a statement and make a vote certain that these programs won't be at risk. These are people that are very vulnerable with these cuts. And with that, Mr. Chair, I yield back.
Gentleman yields back. Is there any further discussion? Seeing none, the question is on the amendment, and the clerk will call the roll.
Mr. Latta? No. Mr. Latta votes no. Mr. Griffith? No. Mr. Griffith votes no. Mr. Bilirakis? No. Mr. Bilirakis votes no. Mr. Hudson? No. Mr. Hudson votes no. Mr. Carter of Georgia? No. Mr. Carter of Georgia votes no. Mr. Palmer? Mr. Dunn? No. Mr. Dunn votes no. Mr. Crenshaw? No. Mr. Crenshaw votes no. Mr. Joyce? Mr. Weber? Mr. Allen? No. Mr. Allen votes no. Mr. Balderson? No. Mr. Balderson votes no. Mr. Fulcher? Mr. Fulcher votes no. Mr. Fluger? Mrs. Harshbarger? Mrs. Harshbarger votes no. Mrs. Miller-Meeks? Mrs. Kamick? Mrs. Kamick? Mrs. Kamick votes no. Mr. Obernolte? Mr. Obernolte votes no. Mr. James? No. Mr. James votes no. Mr. Bentz? Mr. Bentz votes no. Mrs. Houchin? Mrs. Houchin votes no. Mr. Fry? Mr. Fry votes no. Ms. Lee? Ms. Lee votes no. Mr. Langworthy? Mr. Langworthy votes no. Mr. Kane? Mr. Kane votes no. Mr. Rulli? Mr. Evans? Mr. Goldman? Mr. Goldman votes no. Mrs. Fedorchak? Ms. Fedorchak votes no. Mr. Pallone? Mr. Pallone votes aye. Ms. DeGette? Ms. DeGette votes aye. Ms. Schakowsky? Ms. Matsui?
Aye.
Ms. Matsui votes aye. Ms. Castor? Ms. Castor votes aye. Mr. Tonko?
Aye.
Mr. Tonko votes aye. Ms. Clark? Ms. Clark votes aye. Mr. Ruiz? Mr. Ruiz votes aye. Mr. Peters? Mr. Peters votes aye. Mrs. Dingle? Mrs. Dingle votes aye. Mr. Veazey? Mr. Veazey votes aye. Ms. Kelly? Ms. Kelly votes aye. Ms. Barragan? Ms. Barragan votes aye. Mr. Soto? Mr. Soto votes aye. Ms. Schreier? Ms. Schreier votes aye. Ms. Trahan? Ms. Trahan votes aye. Ms. Fletcher? Ms. Fletcher votes aye. Ms. Ocasio-Cortez? Ms. Ocasio-Cortez votes aye. Mr. Auchincloss? Mr. Auchincloss votes aye. Mr. Carter of Louisiana? Mr. Carter of Louisiana votes aye. Mr. Menendez? Mr. Mullen? Mr. Mullen votes aye. Mr. Landsman? Mr. Landsman votes aye. Ms. McClellan? Ms. McClellan votes aye. Chairman Guthrie? Chairman Guthrie votes no. Mr. Palmer is not recorded. Mr. Palmer votes no.
Mr. Weber?
Mr. Weber votes no.
Dr. Joyce?
Dr. Joyce votes no.
Mr. Balderson, are you seeking? Mr. Menendez?
Mr. Menendez is not recorded.
Ms.
Mr. Menendez
Schakowsky?
votes aye. Ms. Schakowsky votes aye.
Anyone present for the roll call? Seeing none, the clerk will report.
Chairman Guthrie, on that vote, there were 24 ayes and 26 noes.
The amendment is not agreed to. Are there further amendments? The gentlelady, for what purpose, the gentlelady from New York, Ms. Ocasio-Cortez, seek recognition?
Mr. Chair, I have an amendment at the desk.
The clerk will report. What amendment? You name the amendment?
It's H2483.
Okay. What is it? Underscore, is it underscore 3?
Yes, yes.
Okay, underscore 3.
And, Mr. Chairman, I will continue to reserve.
Clerk will report. The gentleman for Virginia reserves a point of order.
Amendment to the amendment in the nature of a substitute to H.R. 2483 offered by...
Without objection, the reading of the amendment is dispensed with, and the gentlelady from New York is recognized for 5 minutes in support of her amendment.
Thank you, Mr. Chair. This amendment would require HHS, Health and Human Services, to examine the impact on coverage, access to care, and health outcomes among pregnant women, parents, and infants if Medicaid expansion funding to states is reduced or if enrollment of such individuals decreases following changes to federal requirements that may make it more difficult for people to enroll. And I know that around many of our conversations around Medicaid, there have been a lot of commitments that are made that no one will be cut from Medicaid. I don't know if $880 billion in cuts necessarily squares with, we know that the math doesn't square with everyone being able to preserve their Medicaid coverage and people being eligible being able to preserve their Medicaid coverage. So I think it's important for us to assess what those health outcomes and impacts would be, especially among some of our most vulnerable people, like pregnant women, parents, and also infants that could be affected. Now, we've heard throughout this markup, we heard just recently with Congresswoman Trahan's amendment that we don't need any of these amendments to take our word, that the word has been given, that Medicaid is going to be protected, to trust us that no one is going to be affected by this. But as a woman, the word was given to me that my rights would not be taken away by the Supreme Court, and that wasn't true. As an American, the word was given that our First Amendment protections would be in place for everyone, including green card holders and people who are lawfully here in this country. That didn't end up to be true. So I think we should ensure that if the word here is that we will be deliberative and in assessing who would be affected and to ensure that people would be protected, then I think we should make those assessments. We know that 96 to 98% of people who currently rely on Medicaid are either working, taking care of a family member, in school, retired, or can't work due to an extreme disability. And we've also known from increased paperwork requirements that were eventually overturned or rescinded in Arkansas and states like Georgia, tens of thousands of people were kicked off of Medicaid rolls who were eligible due to clerical errors and other administrative errors. We also know that when the state of Georgia implemented these increased paperwork requirements, 90% of that spending went to administration of this paperwork instead of actually giving health care to people who are eligible for it. So I think it's important that we assess the impacts of rescinding Medicaid expansion and adding bureaucratic paperwork requirements on top of people who are already proven to be eligible. And that's what this amendment seeks to accomplish. Thank you.
Gentlelady yields. The chair recognizes himself for 5 minutes. Again, nothing in this bill touches Medicaid. Nothing in this bill touches Medicaid. That wasn't actually the case when we marked this bill up in committee for the first time 2 years ago, but it is the case now. There was bipartisan agreement to support Medicare and Medicaid care by lifting the IMD exclusion, improving access to care for foster youth in crisis, and supporting care for those in incarceration and reentering their communities. Why aren't those in the bill today? We actually got them signed into law. They don't need to be in the bill today. Medicaid funding for substance use disorder treatment is a bipartisan issue. So to say that we need to study the product is jack. Anyone wanting to speak on this bill? On this amendment, excuse me? Any Republicans? If not, a roll call vote has been requested. The clerk will call the roll.
Mr. Latta. Mr. Latta votes no. Mr. Griffith. Mr. Griffith votes no. Votes no. Mr. Bilirakis. Mr. Bilirakis votes no. Mr. Hudson. Mr. Hudson. Mr. Hudson votes no. Mr. Carter of Georgia. Mr. Carter of Georgia votes no. Mr. Palmer. Mr. Palmer votes no. Mr. Dunn. Mr. Dunn votes no. Mr. Crenshaw. Mr. Joyce. Mr. Joyce votes no. Mr. Weber. Mr. Weber votes no. Mr. Allen. Mr. Allen votes no. Mr. Balderson. Mr. Balderson votes no. Mr. Fulcher. Mr. Fulcher votes no. Mr. Pfluger. Ms. Harshbarger. Ms. Harshbarger votes no. Ms. Miller-Meeks. Mrs. Kamick. Mrs. Kamick votes no. Mr. Obernolte. Mr. Obernolte votes no. Mr. James. Mr. James votes no. Mr. Bentz. Mr. Bentz votes no. Mrs. Houchin. Mrs. Houchin votes no. Mr. Fry. Mr. Fry votes no. Ms. Lee. Ms. Lee votes no. Mr. Langworthy. Mr. Langworthy. Mr. Langworthy votes no. Mr. Kane? Mr. Kane votes no. Mr. Rulli? Mr. Evans? Mr. Goldman? Mr. Goldman votes no. Mrs. Fedorchak? Ms. Fedorchak votes no. Mr. Pallone? Mr. Pallone votes aye. Ms. DeGette? Ms. DeGette votes aye. Ms. Schakowsky? Ms. Schakowsky votes aye. Ms. Matsui? Ms. Matsui votes aye. Ms. Castor? Ms. Castor votes aye. Mr. Tonko? Ms. Clark? Ms. Clark votes aye. Mr. Ruiz? Mr. Ruiz votes aye. Mr. Peters? Mr. Peters votes aye. Mrs. Dingle? Mr. Veazey? Mr. Veazey votes aye. Ms. Kelly? Ms. Kelly votes aye. Ms. Barragan? Ms. Barragan votes aye. Mr. Soto? Mr. Soto votes aye. Ms. Schreier? Ms. Trahan? Ms. Trahan votes aye. Ms. Fletcher? Ms. Fletcher? Ms. Fletcher votes aye. Ms. Ocasio-Cortez? Ms. Ocasio-Cortez votes aye. Mr. Auchincloss? Mr. Auchincloss votes aye. Mr. Carter of Louisiana? Mr. Carter of Louisiana votes aye. Mr. Menendez? Mr. Menendez votes aye. Mr. Mullen? Mr. Mullen votes aye. Mr. Landsman? Mr. Landsman votes aye. Ms. McClellan? Ms. McClellan votes aye. Chairman Guthrie? Chairman Guthrie votes no. Mr. Crenshaw is not recorded. Mr. Crenshaw votes no. Mr. Tonko is not recorded. Mr. Tonko votes aye.
Ms. Schreier?
Ms. Schreier votes aye.
We okay? Okay. The clerk will report the results.
Mr. Chairman, on that vote, there were 23 ayes and 26 noes.
The amendment is not agreed to. Are there further amendments? Chair recognizes the gentlelady from Virginia. For what purpose does she seek recognition?
Thank you, Mr. Chair. I have an amendment at the desk labeled Support 2025 Amendment 8.
And, Mr. Chairman, if I could reserve a point of order.
Gentleman from Virginia reserves.
Thank you,
Point of
Mr.
order. Will the clerk please report the bill? The amendment, excuse me.
Amendment to the amendment in the nature of a substitute to H.R. 2483, offered by Ms. McClellan. At the end of the bill, add the following. Prohibition of certain removals of employees for Centers for Disease.
Without objection, reading of the amendment is dispensed with, and the gentlelady is recognized for 5 minutes in support of the amendment.
Thank you, Mr. Chair. This amendment addresses mass layoffs at the CDC. It would prevent implementation of further layoffs or similar actions that would result in cuts to over 3% of the agency's employees within a 60-day period. And before I go any further, I do want to take a quick point of personal privilege to wish my daughter Samantha a happy 10th birthday today. And that's because we both almost died when she was born by emergency C-section after my placenta ruptured. And that experience furthered my commitment to addressing the horrendous maternal mortality crisis in this country. And that led me to further understand the intersection between substance use disorder and maternal mortality. Now, thanks to CDC data and analysis relied upon by the Virginia Department of Health, specifically from the Pregnancy Risk Assessment Monitoring System, or PRAMS, I came to understand that the underlying causes of maternal death, many of which are preventable. An accidental overdose is a leading cause of pregnancy-associated death and is the leading cause of death for white women in Virginia for pregnancy-associated deaths. But now the entire PRAMS team is gone as part of the cuts to nearly 1/4 of the workforce announced earlier this month by Secretary Kennedy at the Department of Health and Human Services. The PRAMS team was part of the 2,400 employees cut at the CDC. And a recently leaked HHS budget document indicates that CDC funding could be further cut by over 40% on top of these firings. And the devastating impacts of these cuts have become clear as the CDC divisions not only support addressing the maternal mortality crisis and the substance abuse crisis, but workforce safety, injury prevention, HIV, and more. Now, following Secretary Kennedy's announcement, I introduced a bill to prevent these reckless workforce cuts at HHS. And that's because I find it unfathomable and deeply hypocritical for the Trump administration to claim that it wants to make Americans healthier and safer while dismantling the very agencies, workforce, and programs that do that. I'm perplexed that we are authorizing public health programs here today, as critically important as much as I support them, and yet my colleagues on the other side of the aisle have remained silent about the firing of the very staff needed to carry them out. So this amendment would prevent the CDC from implementing further mass layoffs. Now, in addition to its critical role in addressing the maternal mortality crisis, the CDC provides critical public health information, including on substance abuse disorders. It monitors trends to better understand and respond to the epidemic, advances research by collecting and analyzing data on opioid overdoses, improves data quality to better identify areas that need assistance, and to evaluate prevention efforts through the Division of Overdose Prevention. That's on top of all of the other critically important roles the CDC plays, protecting Americans from infectious diseases, and et cetera. Now, it's clear that Secretary Kennedy, Elon Musk, and DOJ don't understand how the CDC or any of our agencies function, the critical role they play in addressing the interconnected crises like maternal mortality and the opioid crisis, the critically important partnership they provide to our state, local, nonprofit, public, and community-based health systems. And these attacks on the CDC's workforce have severe long-term consequences. They are not only destroying today's workforce, they are damaging the pipeline for the next generation of public health professionals. This is not leadership. This is not making Americans healthier again. And on this day that I am reminded of how fragile life is for pregnant and postpartum women, I ask that you support this amendment to help stop the gutting of critically important partners to ensuring we address the intersection between maternal mortality and the opioid crisis. Thank you, and I yield back.
The gentlelady yields. The chair now recognizes himself for 5 minutes. Again, I rise in opposition to this amendment. First, this amendment is largely tangential to the discussion here today. Republicans are here to talk about the critically important policies included in this previously bipartisan bill, a bill that would provide crucial resources for prevention, treatment, and recovery for patients suffering from substance use disorder, patients that are our constituents, our friends, our family members. But it seems all the other side wants to talk about is federal agency employment. Our constituents, our friends, our family members deserve more than this political theater. I urge my colleagues to oppose this amendment, and I yield back. Anyone else seeking to speak on this bill? A roll call vote has been requested. The clerk will call the roll.
Mr. Latta. Mr. Latta votes no. Mr. Griffith. Mr. Griffith votes no. Mr. Bilirakis. Mr. Bilirakis votes no. Mr. Hudson. Mr. Hudson votes no. Mr. Carter of Georgia. Mr. Carter of Georgia votes no. Mr. Palmer. Mr. Palmer votes no. Mr. Dunn. Mr. Dunn votes no. Mr. Crenshaw. Mr. Crenshaw votes no. Mr. Joyce. Mr. Joyce votes no. Mr. Weber. Mr. Weber votes no. Mr. Allen. Mr. Allen votes no. Mr. Balderson. Mr. Balderson votes no. Mr. Fulcher. Mr. Fulcher votes no. Mr. Pfluger. Mrs. Harshbarger. Mrs. Harshbarger votes no. Mrs. Miller Meeks. Mrs. Miller Meeks is not recorded. Ms. Miller Meeks votes no. Mrs. Kamick. Mr. Obernolte. Mr. Obernolte votes no. Mr. James. Mr. Bentz. Mr. Bentz votes no. Mrs. Houchin. Mrs. Houchin votes no. Mr. Fry.